Thanks for joining me today because I want to talk about the immune system and inflammation. These are very important aspects of the effects that cannabidiol can have to control illness and prevent suffering. Today we're going to cover things like the inflammatory and immune conditions, just a collection of a few of those, but you have to extrapolate that to many other conditions. We'll talk about some of the inflammatory pathways, as well as endocannabinoid deficiency, which is probably at the heart of many of these particular problems. I'll give you some evidence for cannabidiol's effects and the benefits that can come with it. We'll talk about the serving sizes and management, and then I'll have references and a question and answer period at the end. So when we're talking about the inflammatory immune response, we're really looking at an immune system that's out of balance, that is reacting and going way overboard for what it should be doing instead of holding everything in balance and in control. On the other hand, you can get to the point where you have immune underreaction, and we don't want to be there either. But for the most part, a lot of the diseases that we're encountering today, including viral illnesses and bacterial illnesses, are actually a result of immune overreaction in which the immune system has tried to overcompensate. And so the things that we see are typically all forms of arthritis, and that's including the osteoarthritis, but as well as the rheumatoid and the psoriatic arthritis. It also includes the autoimmune diseases, all of the autoimmune diseases that have come up. They're all involved with this process, and cannabidiol has the potential for acting on them. The inflammatory bowel conditions, neurodegeneration, including multiple sclerosis, and several of the others we have to look at. In addition, we ought to look at some of the viral illnesses as really being the suffering that occurs with those illnesses is really the result of the immune system going into hyperdrive and creating a lot of the symptoms and the suffering, as well as fibrosis and ultimately much of the suffering and disease that happens. And we also have to look at things like Lyme disease, a bacterial infection by spirochetes that leads to much of the same thing. So some of the inflammatory pathways in tissues, these are the real basics where there's an inflammatory condition and the reaction within the cell, especially the inflammatory cells, is to cause the pain, the heat, the redness, and the swelling. These are classic signs that we see consistently. And the mechanisms involved are quite complicated, but you can see from the diagram there's lots of different pathways that are leading to this. There's lots of signaling going on within the body. Now, part of the reason for that, of course, is as a antimicrobial defense and to mount a protection to the body to prevent the disease or demise of the body as a result of these foreign invaders, whether there be microbial or whether there'll be foreign tissue that somehow enters within the body. But for whatever reason, we're seeing these sort of reactions that have a good side in terms of the protective, but then they also have a very bad side in creating the suffering and the problems that frequently occur with many of the immune conditions. And I'll show you some examples of the body going into hyperdrive and how cannabidiol, with its control, can bring that into balance and restore the healing process and the recovery, as well as take care of the symptoms. The systemic immune connections with any type of immune reaction or inflammation is quite complicated. We usually think of an inflammatory condition occurring at a local site most of the time, but you've got to see that a lot of that focus of inflammation rises up and signals back to the central nervous system. And then the central nervous system, through the autonomic system, comes back to that tissue area and may invoke either inflammatory reactions with cellular immune cells, or reactions within the spleen, or reactions within the nerves, giving additional symptoms, whether that's vascular, or it's hormonal, or it's gut reactions, or it has to do with the tissue and the organs shutting down or compromising their particular ability. maybe as a result of several of these things. So when we're having a systemic immune response, it's not only that localized area, it is all over the body, and the entire body is feeling the results of that. And that's why a systemic approach is so important for managing inflammatory diseases. Within the immune family, there are many different particles, there are many different cells that are there. We'll talk a little bit about the T cell, which handles the cellular immunity, and the B cell with the antibodies that are produced, as well as the macrophage. Now, the macrophages in every part of the body, they sometimes change their names, whether they're glial cells, dendrocytes, whatever their name, they really amount to doing the same purpose. They're extensions of the immune system in that localized area, and they're sort of the ground troops that the immune system calls in to take care of those foreign invaders or that foreign substance. And they're the ones that are producing a lot of the cytokines, the inflammatory substances, and signaling more of their comrades, more of the inflammatory cells to come into the area, populate it. They're also releasing those cytokine substances that lead to vascular changes and lymphatic changes. And as a result, there's quite a bit of reaction coming in. And so it's very important that the macrophages be controlled in this process. A lot of the systems that we're encountering here have to do, and the problem that occurs is that the endocannabinoid system is out of balance. There's a dysfunction going on. And we seem to be prepped for that. We seem to be prepared as a result of perhaps it's our diet, it's toxins, it's previous infections with certain viruses. Whatever the cause, we seem to be particularly prone towards these overreactions and this autoimmune type of phenomena as a result of some compromise within the endocannabinoid system, which is now being called the clinical deficiency, endocannabinoid deficiency syndrome. Now, we've got several examples, and there are objective evidence for these types of abnormalities occurring in things like PTSD, in cystic fibrosis, and multiple sclerosis. We're seeing very definite changes that are happening here. Now, whether it's a matter of too much in the way of endocannabinoid receptors or too little of the endocannabinoids, or whether it's a deficiency in some of the enzymes that degrade some of the endocannabinoids, or just a number of the different transport molecules. It's not always clear. In one situation, in every situation, it changes. And so there's no consistency about it in terms of one direction or another. That's why it's very important that there needs to be modulation. There's no one direction that the cannabinoid system needs to be regulated and controlled. But that's where cannabidiol can come in. What we're seeing with cannabidiol is a direct effects on the central nervous system, at the synapses, where it's involved in that communication from the afferent nerve cells that are picking up the inflammatory signals, and then sending those out to distant parts of the body and giving the reactions that are there. So you've got this wonderful control mechanism dampening down the reactivity of the body from the brain side. And then vascularly, cannabidiol really controls the extremes of vasoconstriction, preventing the vasoconstriction and modulating it and preventing too much and keeping it under control. It's providing organ protection. In study after study, cannabidiol has been protective on the brain, on the kidney, on the liver, on the lung. All of these tissues are protected from damage from extreme immune and traumatic reactions that can occur. But most importantly in all of this is probably the immune modulation that occurs. And I've got to say immune modulation because once again, cannabidiol is controlling and doing the right thing at the right time. It's controlling the right cells and preventing the inflammatory reaction while maintaining the resistance to infection and to invasion, as well as the anti-cancer effects for identifying foreign tissue and abnormal cellular structures. But above all of that, cannabidiol is restoring the endocannabinoid system. It's rebalancing the number of receptors and the number of endocannabinoids that are present in order to restore the whole body and get the body back into homeostasis and balance. Specifically, cannabidiol is working on the immune system to reduce the number of macrophages. It actually induces the number of macrophages to get smaller by leading them to their self-destructive phase. Every one of these macrophages, the way that they work is they populate an area and they go away, not because they go off into another distant port, but because they disintegrate, they dissolve, they go through a process called apoptosis. And this sort of cell suicide that occurs after they've lived out their usefulness or they've gathered up waste material, then they self-destruct. Cannabidiol promotes that self-destruction when they're no longer needed. It also decreases the macrophages and their production of pro-inflammatory substances, the cytokines, the tumor necrosis factors, the interleukins 1, 6, and 18, as well as 17. But at the same time, and here's another example of cannabidiol and how it really does the right thing, the Boy Scout of all molecules, in that it increases the anti-inflammatory cytokines, the interleukins 4s and the interleukin 10s that may be part of the process of cardiovascular disease and atherosclerosis. It's interfering with those, it's raising those levels up to help and prevent these particular processes in our body. At the same time, it's protecting our bodies, and it's not interacting and causing any difficulty with infections or immune challenges, even from immunizations that may occur. Now, let me give you some evidence for this. Cannabidiol was used in bone marrow transplants for people with leukemia and other diseases. They were monitoring specifically for graft versus host reactions. Cannabidiol was able, for just the administration of cannabidiol for 30 days, actually 37 days, the cannabidiol was able to reduce the number of graft versus host reactions by 70%. Now, that's a process, the graft versus host reaction, is where somebody is transplanted a particular organ. In this case, it's bone marrow. And the transplanted cells actually mount an inflammatory and destructive action on their host tissues, actually causing a number of different immunologic reactions on the skin, in the gut, in the liver, many different areas. And what cannabidiol is reducing this reaction. Now, we do use, and there's very vigorous use of anti-rejection drugs that are immune suppressants. But in addition, adding cannabidiol really accelerated and provided the additional benefits for preventing this very difficult and challenging situation within the first 100 days of a transplant. It reduced the number of cytokines, it controlled those, and it controlled the T cells. And so there wasn't any inflammatory reaction, reduced it dramatically. And even afterwards, after 100 days, it was reducing the number of inflammatory reactions were occurring. There's evidence in the gut where cannabidiol is interacting with some of the endocannabinoid receptors. It's blocking the tumor necrosis factor cytokine, the one that probably causes most of the damage and the inflammation that goes on in the gut. And that also leads to leaky gut. It leads to an ability of different particles and microbes to enter into the bloodstream through the tissues as a result of a release of some of the tight junctions. Cannabidiol is maintaining those tight junctions. It's restoring them. It's reducing the amount of motility issues that come along with inflammatory bowel in the disease, inflammatory disease in the bowel. And it's reducing pain all along the way. So you get quite a combination of effects from cannabidiol working on the symptoms as well as the immune function. Now, this was a recent case of a bedbug reaction. This patient went to a movie theater, sat through a good 2 hours of movie, and when she came out, she discovered she had 112 bites on her legs from where she was sitting in the theater. Within 2 hours, she developed abdominal pain, nausea, vomiting. There was joint, muscle, and pain, and she had a rash like the one I display here, an urticaria that was intensively itching and occurring in all parts of the body. It's not unusual for bedbug reactions like this to occur. It's really quite the phenomenon. Normally, the reaction time it doesn't occur for a day or more, but it can be quite severe, and it is lasting, sometimes lasting as long as 2 or 3 or even 4 weeks, enduring. Now, this patient started using cannabidiol. She was able to control the itching and stop the nausea and vomiting and the abdominal pain completely. The joint and muscle pain, they went away. Now, she was using cannabidiol about 30 milligrams, 2 and 3 and 4 times a day in order to control the symptoms as often as every 6 hours. And sometimes you need to do that in order to get your system back in order, considering that the half-life of cannabidiol, at least at its highest levels in the bloodstream, may be as little as 6 hours. Fine, use as much as you need. She did, and the result was she was able to control all of her symptoms and return to a relatively normal life in spite of this severe reaction that's occurring. Later on, she said all of the other drugs that she was prescribed and recommended were treating symptom, but CBD goes right to the root. I didn't know how amazing it really is, and she found out very quickly. Now, this is evidence in a wound, a little bit more with the skin. This is a gentleman who had a wide excision of a malignant melanoma on his skin, and he had difficulty with a skin graft. It was going to be delayed for about 2 months, and he decided that he would follow my recommendations and use the cannabidiol to help heal the wound and control the pain. Because the other part of this was that he was in quite a bit of pain, and he was taking narcotics in order to control the pain, but it really wasn't sufficient. So he started using cannabidiol orally, and he was using it topically around the wound. Now, initially, I don't have the image, but it was infected. There was a purulence to it. It looked really nasty. Within 24 hours, the antibiotic effect and the anti-inflammatory effect took hold with the cannabidiol and cleared up the wound so that the inflammation died down. And from then on, for the next 12 weeks, it healed at the rate of about 1 centimeter per week. A little less than that, but incredible contraction of this large wound without pain, without discomforts, without complications. In addition, there was a firm fibrosis that occurred over the area, and right now the gentleman is cancer-free, as well as his wound is healed without any neuropathy or discomfort to the area. A stunning result, and I think it's an example that could be paralleled in other types of wide excisions and other types of lesions that occur. So let's get back over to cannabidiol. You know by this time about cannabidiol being from cannabis, the two major types being marijuana and hemp, and that CBD is primarily from hemp, and it improves health. It's safe, it's legal, it's effective, and that CBD doesn't cause any reaction toxicity, and there's no significant interactions with CBD with other drugs. Most of all, cannabidiol restores the endocannabinoid system to return us back to health. If you're going to use cannabidiol for immune types of problems, start off with a standard dose, 15 milligrams twice daily with a tincture. Adjust it early and boldly to control the symptoms. Get those symptoms under control. You gain confidence with the patient, and the patient gains confidence in you. Whatever form is available, whatever form the patient would prefer, that's fine, use that. Typical duration is 6 to 12 hours. During those acute suffering phases, you may have to use it more frequently, but you can decrease the dose. As the symptoms come under control, reduce it to what you need for this particular condition. And the target dose not for cardiovascular disease, but for immune and inflammatory reactions, is 60 milligrams. And so that's about the target dose. But as I mentioned, with this bedbug reaction, went up to 120 milligrams, and that was the effective dose. And she backed down quickly after she got control of it and returned to normal with a much lower dose. In many cases, once the disease is controlled and the inflammation is calmed down, you can get by with much less, even a quarter of the acute dose. So who should be using cannabidiol? We need to look at patients who are really unresponsive to any other measures, or those who are exposed to toxins, or toxins could cause particular damage. Those with impaired organ functions like heart or kidney, and those people who really need the maximal support and protection right now that cannabidiol can offer. And other conditions that cannabidiol can help in is the epilepsy and brain conditions, Crohn's disease, Alzheimer's, and chronic narcotics. All of these things, cannabidiol can be enormously helpful on. So we'll just go over some of these things and talk about the huge burden that inflammatory disease that we face. In my opinion, inflammatory disease is at the cause for almost all of the major conditions and all the major suffering that we are encountering in the world, whether it's obesity, diabetes, depression, anxiety. Many of these things are related to a dysfunction of the endocannabinoid system and the resulting inflammation that's closely connected. It's been said and it's been written about as the endocannabinoid system as that interface of the body between the inflammation and the entire body systems. And so it's a key pathway that cannabidiol addresses specifically. It's well supported in clinical studies and preclinical studies. And again, there's no adverse effects, toxicity, or drug interactions. The dosing is quite modest with good results. And rather than increasing the doses after you achieve control, you're able to decrease the doses significantly and put people on a maintenance program. So that's really what I have to tell you. I've put some references in. This is a folder that you can go into and Google Drive and find out more about inflammation and immune conditions, as well as view these particular slides. So at this point, I'd like to open it up to questions, and looks like I've got a couple, so I'll jump into those.